These pills are part of a drug trial in South Africa that may help revolutionize tuberculosis therapy. A new regimen cured 85 to 90% patients with drug-resistant TB, up from 50% for previous regimens. Plus, the treatment worked for two key groups often left out of TB treatment research.
We found safe and effective treatment for pregnant women and children, but also we've awakened the field to say, actually, this has to be done.
Women, children, and men in the BEAT Tuberculosis trial all received the same regimen. That's a change from previous treatments, even though TB often affects entire families.
The daddy gets one easy regimen to take, and then the mom gets a more complicated one because she's pregnant, and the child gets an even more complicated one. Dad is cured after 6 months, mom is cured after 8 months, and we wait, or 9 months, we wait for 18 months for us to be able to know if the child is cured. So that's really an unfortunate set of circumstances.
The study shortened treatment of 6 months for everyone, and it did so without the harsh side effects of previous treatments.
People would say to me, Doc, I would rather have TB than the medicines that you're giving me. So in the olden days, they were terrible, and a third of our patients, half of them would lose their hearing.
Dr. Pauline Howell supervised the study. She says the new regimen has the backing of the World Health Organization.
That basically means that countries can take the recommendation of the regimen and run with it, which is fantastic, because the more options we give countries to work with, the more options we can then translate to patients who need treatment.
Leslie Marbury is Southern African Mission Director for the United States Agency for International Development. She says breakthroughs like this new treatment could eventually pave the way for a world free of, or at least less troubled by, TB.
They're coming from high-burden countries like South Africa who are motivated, then I feel confident that we can end tuberculosis as a global health challenge.
TB claims over 1 million lives each year, but experts say with early detection, simplified treatment regimens, and greater access to life-saving drugs, these deaths can be dramatically reduced. Sahir Kasim, VOA News, Johannesburg, South Africa.